Hello everyone. Am I audible?
Yes, you're audible.
Hello everyone. This is Anika Tahsin and currently I'm working as a research fellow at Bangladesh Institute of Innovative Health Research. Today I'm going to discuss about an article and title is The Reality of Embedded of Drug Processing Practice, Understanding the Sociocultural and Economic Aspect
একটু
of
ইন্টারাপ্ট করছি, আপনার এন্ড থেকে আমরা ইকো শুনতে পাচ্ছি। হয়তো আপনি দুইটা ডিভাইস থেকে জয়েন করেছেন, তো সো একটা ডিভাইসে একটু মিউট করে দিয়েন।
না আমি একটা ডিভাইস থেকে জয়েন করেছি। হ্যালো,
আচ্ছা, হ্যাঁ,
শোনা ক্লিয়ার?
তবুও ইকো হচ্ছে আর কি। আপনি কি হেডফোন ইউজ করছেন?
হ্যাঁ
সেক্ষেত্রে
হ্যাঁ
হেডফোনটা খুলে নিয়ে একটু কষ্ট করে।
ওকে।
ওকে,
এখন ক্লিয়ার?
জি শুনতে পাচ্ছি।
Okay. My presented topic is the reality of embedded drug processing practices, understanding the socio-cultural and economic aspect of the use of medicine in Bangladesh. Um, Actually, the main focus area is uh, why actually people are purchasing irrational antibiotic use from the retail drug shop, and I'll discuss from the sociocultural aspect and economic aspect. And this study was published in PLOS One, and date was June 28, 2023. And here is the author, Mohammad Shahzan, Miah, and so on. And here is the citation. Okay, and now let's move to the background studies. If we talk about the background studies, we all I think know that the term antimicrobial resistance, and it is considered that antimicrobial resistance is the greatest public health threat in 21st century. And the retail drug shop are the one of the kind responsible for that. They use Actually, they used to sell irrational antibiotic. There is actually several factors responsible for that. Like it is easily accessible, and medicines are also accessible. That's why here is statistics. 1/3 of the world's population lack access to essential drugs, and 52 billion millions of 52 billions dollars spent annually on inappropriate drug use, and total 2.6 million deaths occur due to the severe adverse drug reaction. That's why it is considered that it is the greatest public health threat in 21st century. And the retail pharmacy shop and the pharmacists are the most responsible for this. And research show that people prepare pharmacies over hospital for various reasons like quick access to medicine and advice. People actually easily access medicine in retail drug shop. And in these medicines are lower cost comparatively the formal healthcare setting. If they go to the formal healthcare setting, they have to spend a lot of formalities and spends a lot of costs. But comparatively, they don't have this kind of costs. They don't have to spend this kind of costs in informal healthcare settings or retail drug shop. That's why pharmacists are the care responsible for this. And actually, how people buy medicine in Bangladesh? Okay, retail drug stores are considered it is the most common healthcare sources in Bangladesh. That's why 80% of the people visit drug stores and quick doctors instead of hospital, and 76% self-medicate even with antibiotics. And one we have 6,919 licensed pharmacies, and but an equal number of operate without a license. 92% of the drug sellers are cigarette pharmacies. Cigarette pharmacies are refers to don't have formal training, but they only have 3 months training. And 95% of the drug sellers are unaware of drug side effects since they don't have formal training. That's why they have lack of knowledge, lack of awareness about how to deal with medicine, how to manage with medicine. That's why they're unaware about the drug side effect. Now let's move to the another slide. This is why inappropriate drug selling is common. Okay, the number one is lack of education and training among drug sellers. Actually mentioned mentioned that a lot of not a lot of 92% of drug sellers have only C grade training. They don't have formal training. That's why they don't aware about how to manage medicine. And then that is profit driving incentive of pharmaceutical firms. If we can see that pharmaceutical companies actually lucrate people about by giving offer, and people sometimes don't aware about this, and weak enforcement of policies. Since in 2026 there is a policy of national drug policies, but maximum of the people don't have any idea about this drug policies, and also the informal healthcare providers maintain these policies. They also don't know about this policy. This is the reason of inappropriate drug selling is common. Okay, now let's move to a study objective. This study objective is about actually understanding drug purchasing behavior from the customer's perspective, and I'll focus here about the sociocultural and economic factors of affecting medicine purchasing. And impact of this study, the study will impact in helping policymakers to enforce rational drug use, and supporting universal healthcare coverage, and also have to reach SDGs goal 3.8. And this goal is ensure access to safe, effective, quality and affordable medicine for all. Here is the methods and medicine. It's an ethnographic research. Being an anthropology student, I prefer I choose this studies because of ethnographic research. And the data collection method was participant observation, and interview was in-depth interview and key informant interview. And the study duration was October 2020 to May 2021. And the study location was Shahjalal Upashahar, Ward 42, Sylhet Metropolitan, Bangladesh. And the socio-demographic background of this participant. The 30 interview was conducted in-depth interview, and 10 was informant interview. And if you look at the characteristics of participant, 50 participants residents were suburb, and 15 was slums. And in the case of informant, 8 was suburb and 2 was slums. And in the case of participants, in the case of participant in the interview, 15 participants was client, and 10 was patients, and 5 was trainee sales assistant. And in the case of informant interview, 3 was drug seller, and 3 was medical representative, 2 was experienced sales assistant, and the rest 2 was regular customer. Here is the system. In the case of in-depth interview, 20 participants was male and 5 was female. And the informant whole time was male. There was no female participant. And the case of education, 7 participants have education 0 to 5 standard, and 5 was 6 to 10 standard, and 8 was 11 to 12 standard, and 10 was above 13. In the case of K-informant, two participant was 6 to 10 standard, and three participant was 11 to 12 standard, and the five participant was above 13 standard. And the profession in the case of interview, 8 participant was driver, and 5 was rickshaw puller, 4 was NGO worker, and 3 was government service holder, 5 was a teacher, and 5 was homemaker. In the case of K-informant interview, 3 was provider cum seller, 3 was medical representative, 2 was experienced sales assistant, and 2 was regular clients. Demographic of retail drug store insight from the drug shop staff and customer. Actually, there was the study setting was in three drug store. Here's the details about this drug store. And drug store one was located in higher income residential area, and drug two was located in slum area, and drug store three was located in commercial bazaar area. In the case of seller, rural medical practitioner was the seller of drug store one. Sales assistant and occasionally seated health assistant was the seller of drug store two, and the cigarette pharmacist and sales assistant was the seller of drug store three. Higher economic educated and service holder was the client of drug store one. People living with poverty and rickshaw puller, their labor was the client of drug store two. Higher income educated service holder, people living with poverty with the client of drug store three. In the case of commonly reported health problem is diabetic, blood pressure and heart disease was the commonly reported health problem in drug store one. Gastric pain, diarrhea, common cold and fever was the commonly reported health problem of drug store two. And diabetics, blood pressure, diarrhea, pain, accident, patient, cold fever is in drug store two. In the case of products sold, brand drugs, imported medicine was in drug store one, non-brand, low safety, allopathic, herbal drugs in drug store two, brand, imported, non-brand, low safety, herbal is in drug store three. Now we are discussing about, I'm going to discuss about the results. Actually, why people are tend to buy medicine from informal healthcare like retail drug shop. One of the reason is people visit with preconceived ideas in drug shop. People visit drug store with preconceived ideas about trade name, brand, and doses. Actually, their people are influenced about their first experience. Also, there is a quote that I have been taking this medicine for 3 years. I feel good and have no complaint regarding this. So I mostly bought 1 month's drug at the same time. And actually, these people have lack of awareness and knowledge about antimicrobial resistance and the and the situation of condition about the irrational antibiotic use. That's why they tends to buy antibiotic with their preconceived idea. And the second is people who visit the drug store without any ideas about medicine they want. Sometimes people visit in drug store without any idea about about antibiotic. That's why they're influenced by their personal experience or they're influenced by similar symptom among family and friends. One of the quotation from observation is give me a pactakas gastric drugs, and the reason is the reason is they have a fixed budget for purchasing antibiotics. If they go to the formal healthcare setting, they don't buy it. They don't buy it with their fixed budget. But instead of going there, they go to informal healthcare settings to buy with their fixed budget purchasing. Also, they process with antibiotics with a loan and by installment payments. Since maximum of the people in people in Bangladesh also in the study participants was under low income budget. That's why their customers view is they consider actually retail drug shop stores as a poor people's hospital. They consider it as a poor people's hospital, and they don't have to actually spend extra money with consultation fees and travel costs. Also they can buy it by in loan or credit. That's in this way they buy they build good relationship and trust between sellers and customers. This That's are the reason. And one participant put it, I just ask for the drug by name and often by element, whatever I need. The sales assistants write the amount in the loan book. That I get my salary, I pay the drug bill in cash. The main reason is economic factor. Since they are not economically rich, that's why they choose this informal healthcare cities. And if you look at the drug dispensers view, according to them people actually buy a small amount of daily instead of purchasing due to expensive prices. The main thing is economic factor is the responsible for this. Drug sellers put more effort into the substitute of generic drugs to maximize profit. Okay. Uh, in the case of seller, they actively substitute generic drugs when a request brand is unavailable. Uh, se- um, Requested a brand is unavailable. Actually, they do this for their profit maximization. Uh, and also the seller have also that since the seller don't have the knowledge and awareness about what is the worst thing of irrational antibiotic use. That's why they do this for their profit maximization. They also dispense non-break and substandard drugs. Um, There is this speculation and negotiation in purchasing drugs. Customers are thanks to that they expect quick recovery after taking medicine. That's why they go to the retail drug shop. In retail drug shop, they can buy antibiotics they are affordable prices. Here is an conversation from observation. The customer asks for I need medicine for sneezing and fever, and seller dispense a 3-day course of antibiotics. But customer requested a 2-day course due to lack of money. Seller agree but advice completing the full course. Customer smiles and replace of course else, but may not. The other thing is the customers and the people are they don't fulfill their goods. This is so harmful for their health. But since their economic condition is not good, they do this. And sellers, the retail drug shop sellers are also agree with this. They support this. That's why they would go to the retail drug shop. A drug transaction pick is the pharmacy is a comprehensive primary healthcare service. I also mentioned that the people of Bangladesh considered the pharmacy as their primary healthcare center. There are various reasons why they are considered this. They in retail drug shop, the seller are prescribing and selling medicines, and measuring blood pressure, testing for diabetes, seeking for favor, providing healthcare information, and booking doctors' appointment and home delivery. Actually, they get all kinds of benefits their according to their desire. That's why they consider as their primary healthcare provider. Also, they also access it easily and with lower cost. That's why they think it things and considered as a primary healthcare provider. And trust in sellers and the service they provide. The pharmacist as a healthcare consultant. Here, pharmacy, retail drug shop sellers and customer have trust and good relationship. Uh, since they prepare first result, and sometimes they're leading to high dose antibiotic use to get well soon. And all kinds of their needs fulfill all kinds of their needs fulfilled by the retail drug shops sellers. That's why they have a good relationship. They have a good relationship with healthcare provider. Sorry, sellers and customers. Okay, now we're going to discuss our discussions. Actually, drug is to serve as a comprehensive primary healthcare points in communities. In the case of Bangladesh and lower middle income countries, and many unlicensed retail drug stores operate with short trained sellers, ever secret training, and customer negotiate on brand price or dose, often bringing good prescription or sample. Preference for antibiotics, export remedies leads to incomplete doses and misuse. Drug sellers substitute collect or recommend non-brand drugs to maximize profit. Implication for policy and public health. Stakeholders need to regulate and monitoring over-the-counter drug sales, and they have to raising awareness among both sellers and customers about proper drug use and side effects, and addressing antibiotic resistance by ensuring safe, quality, assured medicines, flexible payment options, improve medicine access for the Fabulous. Here is my presentation, and if I talk about this study, actually there is two main key factor is responsible. One is sociocultural practice, and the second is economic practice. The sociocultural practice is people have lack of knowledge, awareness about antimicrobial resistance or the um, antimicrobial resistance, and about what will they pay for the if they uh, use inappropriate or inappropriate antibiotic or irrational antibiotics, and that's why they practice the practice is what is greatly acceptable. And the second is economic conditions. Since they are not economically sound, that's why they prefer in formal healthcare settings rather than formal healthcare settings. They don't have to buy extra money like travel costs, and also another formalities they don't have to uh, pay for it. That's why, and also they don't have to do any kind of formalities, and that's why and also they easily get antibiotics from retail drug shops. That's why they choose it. Thank you, everyone. Now I'd like to open the floor for question and answer session.